Hi, I'm Dr. Lawrence Waters. I'm a coach here at Tradewinds Health and Fitness. You may have seen me coming in over the past few weeks and starting to coach classes. So happy to be here. So how long have I been coaching? I have been coaching, that can actually be a complex question. So I guess the first instance of me coaching fitness classes would be when I was a cadet back at Indiana State University, leading physical fitness training for the other soon-to-be officers. Then obviously as an infantry officer in the Army, I was responsible for the health and well-being of my entire platoon, which included designing fitness programs for them. There was a point in my career that I realized that there was a severe lack of knowledge on the best practices behind strength and conditioning. And that's when I was introduced to CrossFit as a method for general physical preparedness. So at that point I started pursuing CrossFit as an amateur athlete, and when I left the Army I decided to go and get my CrossFit level 1 certification, and after that it was sort of murder she wrote. I've been collecting certifications and knowledge and information at any point that I could get it. So I have a particular memory of when I decided I wanted to be a physical therapist, and that led me down the path to being a coach first. I had a soldier when I was in the Army that worked with me. He was a shining star, and I was preparing him to go to Ranger School. And part of that process is we send them to a pre-Ranger training. And at that point I had been doing CrossFit for a while, and the athlete started doing CrossFit with me, and he went to this pre-Ranger training, and the next I heard, I had to go visit him in the hospital. He came down with rhabdomyolysis. And it was sort of at that point where my passion for coaching and training and learning the principles of strength and conditioning, really that fire was lit, because I ardently believe that it's possible to train people to become what we consider superhuman without breaking them, without causing acute kidney injuries. And so it was at that point that I had to go and find out for myself what the correct way to train someone so that they don't become very sick and end up hospitalized. I think largely I wanted to become a coach first. That was actually my real goal, or my initial goal. As I left the Army, though, I realized that I wanted a certain level of education to go with that, and so it was whether or not I wanted to pursue a bachelor's in exercise science or a master's in athletic training, and then there was the option to pursue a doctorate in physical therapy. And that presented a profession. I was really influenced by some of the greats in physical fitness and in CrossFit, like Kelly Starrett, Gray Cook, all those big names. You know what do I enjoy most about coaching? The thing that I enjoy the most about coaching is when an athlete clicks with a movement. When you've been cueing them and you've given them about 1 million different cues, over maybe weeks or months, and all of a sudden that connection between what their body is doing and what their brain thinks it's doing is finally in sync, and they just move and they get the movement, and they have this deeper understanding of what their body is capable of, and that is by far my favorite moment. If you ever get the opportunity to go for your CrossFit level 1, sorry, one second, I have to restart because the thing I enjoy most about physical therapy is actually really in a similar vein. So if you ever have the opportunity to go to your CrossFit level 1, they talk about health and wellness being a spectrum with sickness and pathology on one end of it, and again, superhuman performance on the other side of the spectrum, and we all exist somewhere on it. And so when I have a patient who has severe pain, they had labral tears, they had rotator cuff tears in their shoulder, and they don't think it's ever going to be possible for them to reach overhead and grab a plate out of the cabinet again, or to do a dumbbell press again without severe pain. When I finally get them moving and get that pain to subside and give them that relief, and again, that moment that it clicks in their head that they are capable of reaching overhead without pain, that's a really special moment for me. Anyways, thank you for having me, and thank you for this wonderful interview. I'm incredibly excited to be here and Tradewinds Health and Fitness. I'm excited to watch clients achieve new heights that they didn't think was possible, and I'm excited to start offering assistance to those who are in pain and need help with with exercising pain-free. So again, just thank you for this wonderful opportunity, and I look forward to working with all of you.